All right, we're back, and if you've just had a prostate surgery and you're experiencing issues controlling your bladder and urine leakage, well, this is the video for you. Welcome back to the channel, everyone. Sit back, relax, while I help you put a plan in place to fix your urine leakage issues. If you're new here, my name is Eric. I'm a men's health physiotherapist, and this channel is dedicated to men's health physiotherapy and to helping you overcome men's health issues. I post new videos every single week, so make sure to subscribe to my channel by clicking the red subscribe button directly below and join our growing community. Now, some common prostate procedures include the radical prostatectomy and transurethral resection of the prostate, also known as a TURP. Yes, I know there's a few more, but let's focus on these today because the whole idea of having one of these procedures completed is to either remove cancer from your body, such as prostate cancer, or it's to hopefully get some symptom relief with your urine flow and urinary issues. Now, whatever the case may be, these procedures are not to be taken lightly as they are what's referred to as invasive surgeries. This means that the surgeon performing the procedure must go into your body, cut, stretch, and maneuver tools in place to get the job done. Great. The surgery was successful. The prostate was either removed or resized. Job well done. Well, not so fast, because almost every man undergoing a prostate removal procedure will experience urine leakage and bladder control issues after the operation. And this can become extremely frustrating as some men might have to wear penis clamps or even male continence pads in their underwear afterwards. Now, most men will regain full control over their bladder and urine leakage in around 3 to 18 months following their procedure, with 8 to 10% of men experiencing long-lasting urinary control issues. Now, that's enough of the doom and gloom because my job as a men's health physiotherapist is to teach you how to fix this issue, because there is so much you can be doing to help slow or even stop urine leakage so that you don't become part of the 8 to 10% of men experiencing these issues long term. So take out those notepads because I'm gonna walk you through exactly what you need to do, and let's get into it. Starting immediately following the surgery, let's come to grips with the fact that your body has been through a lot of trauma following a prostate surgery. It doesn't matter what one you had, your body's been through trauma. You've likely had a catheter tube inserted to help you pass urine afterwards, and there's no doubt that you're experiencing soreness in your groin region. This is normal, and over the coming months, your body is going to start to heal, and you're going to do everything in your power to help your body heal faster. Okay, step number 1, when you're experiencing urine leakage, you must go to the pharmacy or chemist or shop online at Amazon and purchase male continence pads. There is nothing to be embarrassed about here. These pads go on the inside of your underwear and they prevent urine from seeping through, and trust me, they're a lifesaver. These pads are also discreet and disposable, meaning that if you're out and about and you experience some small urine leakage, you can simply slip into the bathroom, swap out your pad, and carry on your way. Continence pads are clearly not a long-term solution to your urine leakage problems. However, they are essential because they allow you to continue living your life. No one wants to be stuck inside in fear of leaking urine out in public, so make sure you pop in a pad and get on with your day. Now, before we move on to step number 2, when you're purchasing male continence pads either in the store or online on Amazon, make sure you buy enough. Expect to need these pads for 2 to 4 months, so buy enough of these and make sure you get the correct size. A lot of the pads that you'll see online or in the store have sizing guides, and it's just based off the size of your underwear. Get the right size, buy enough, you'll be good to go. Okay, step number 2. So remember earlier in the video when I said that the surgeon had to cut, stretch, and remove part of your insides when performing a prostate surgery? Well, this surgery causes a lot of damage in the body. And this means that the internal structures that are responsible for you holding your bladder, called sphincters, well, they're a little stretched at the moment, and that's why you're experiencing urine leakage throughout the day. Now, step 2 involves monitoring your fluids intake to make sure that you're helping your sphincters heal and not overloading them and making your urine leakage worse. Now, in the beginning, following your surgery, you want to make sure that you're staying hydrated. However, you don't want to consume too many fluids, as this will make your leakage much worse. I suggest starting a bladder diary either on a piece of paper or in your phone, where you can track exactly how much water and fluids you've had to drink, along with the number of times you've urinated during your day. Put simply, you want to find the balance of consuming fluids and urinating. And I'd recommend setting a daily schedule of only consuming fluids with your main meals, such as breakfast, lunch, and dinner, and getting into the habit of urinating every 2 hours, even if you don't have to go to the bathroom. Getting into this schedule will help you to reduce the amount of leakage you experience. And it also helps you if you set a phone timer or a separate timer within the house to remind you to go to the bathroom on that 2-hourly schedule. Now, we all love our coffee, tea, and alcohol. However, these 3 drinks can do a good job of making your urine leakage much worse. That's because any drink that contains caffeine or alcohol are what's called a diuretic. And this means that when a diuretic is consumed, they make you want to urinate more frequently. Now, I'm not saying you need to give up these drinks entirely. I'm only suggesting that you monitor how much you consume and to be strategic on when you consume them. Here's my advice. Try to stick to only 1 cup of coffee a day until your urine leakage is well under control. Do not consume any caffeine, including pop, soda, coffee, or tea after 3 p.m. and then stop consuming all fluids altogether, including water, around 6 p.m. at night after dinner. This will allow your body to process the fluid and gives you enough time to go to the bathroom to completely empty your bladder before going to bed. Lastly, you must monitor your alcohol consumption. On top of being a diuretic, alcohol actually puts your bladder to sleep, making your leakage so much worse. However, I'm a firm believer in you getting out and living your best life. Now, if you're gonna go and consume alcohol, stick to 1 drink or switch to a non-alcoholic beverage so that you don't experience any urine leakage issue. Also, don't forget to wear your continence pad and prepare for any urine leakage. Again, these rules aren't meant to last forever, only until we regain control of our leakage and our bladder control. Step number 3, you must consult with a men's health physiotherapist to strengthen up your pelvic floor muscles, because your pelvic floor muscles help to support your bladder and they assist you with urine control. Now, when you have a prostate surgery, these muscles become damaged and they need some rehabilitation and strengthening. If you've never heard of your pelvic floor muscles before, don't stress. That's why we have men's health physiotherapists like myself who can help you and teach you how to strengthen these muscles up so that you can fix your urine leakage once and for all. Now, after a prostate removal surgery, men are commonly given a quick rundown on how to contract their pelvic floor in hospital by either a continence nurse or a physiotherapist working in the hospital, and then they're sent home and on their way. The majority of these men never make a booking in with a private practice physiotherapist for help with their pelvic floor strengthening after that. And let me be really clear, you will need a personalized pelvic floor program to help you with your urine control afterwards. So please do yourself a favor, find a good pelvic floor physiotherapist in your area and consult with them. I promise it's gonna shorten your rehabilitation time so that you can just move on and get on with your life. Okay, let's recap this video. Step number 1 in gaining control over your leakage is to go out and purchase male continence pads. They're very easy to find on Amazon or in your local pharmacy or chemist, and they are an essential part of your recovery. Pop these continence pads into your underwear and go out and enjoy your life. Step number 2 is to monitor your fluids. If anything, get into a routine of regular trips to the bathroom, reduce your caffeine intake, and think about giving up alcohol for a couple months until you have better control of your urine leakage issues. Step 3, and arguably the most important, is to start strengthening your pelvic floor muscles. This is gonna help you put an end to your urine leakage for good, and I cannot stress how important this step is. If you're not at the stage where you're comfortable going to see a pelvic floor physiotherapist in person, I've made a heap of videos that will help get you started. Make sure to check out the video description located below, as I will link these videos for you to go check out. And that's gonna wrap up today's video. Hopefully you feel a little bit more empowered to tackle your urine leakage problem head on. And remember, this isn't gonna fix itself overnight. It might take 6 to 8 months. However, if you follow the 3 steps we covered in this video, you're gonna be off to a fantastic start. You know the deal. Make sure you like the video, subscribe to the channel by clicking that red subscribe button below, and remember, regardless of your situation, keep going, and I'll see you in the next video.